My guest on this episode talks about choosing your area of disruption. I first met her at the Women's Leadership Institute, where she delivered an engaging and powerful keynote speech. She joins us to share her fascinating journey into public health and so much more. You're listening to the PHEC podcast, episode 396. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. I can't wait to introduce you to my guest. I know I say that every time, but it is exciting for me to bring each guest to you on this podcast, especially the one we have today. So before I dive in too far, I'd like to introduce myself if you're brand new to this podcast, or reintroduce myself if you're a returning listener. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and government agencies that serve Black, Indigenous, and people of color communities, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always humbled and honored to serve. We help our clients collect, analyze, manage, and communicate their health data and health information in plain language to the communities they serve. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website, DrCHHuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. Now, again, I'm excited to introduce you to my guest on this episode. Many of you know her already, but let me formally introduce her to you, and then I'll connect our conversation. Dr. Raymona Lawrence is the founder and CEO of Dr. Raymona Lawrence Coaching, LLC, where she is a dynamic keynote speaker, corporate trainer, and consultant. Her life's work and heartfelt mission is to challenge broken systems that keep people from reaching their highest potential. Therefore, she uses evidence-based principles of community engagement, diversity, equity, and inclusion, and psychological safety to curate transformational change strategies within teams and companies. Dr. Lawrence also delivers engaging and thought-provoking speeches and training to thousands of individuals across the United States and globally. She has facilitated diversity, equity, and inclusion and psychological safety training and consulted with companies such as Arbonne International, Rodan and Fields, Forma Therapeutics, and Georgia Council of Court Administrators, the National Association of Graduate Admissions Professionals, and Novo Nordisk. Dr. Lawrence is highly intrigued by the breadth and depth of human difference and is passionate about helping individuals and organizations develop curated strategies to connect to diverse communities, customers, and team members. Dr. Lawrence has a doctorate in public health, extensive training in community engagement, health disparities, and health inequities, has a certificate in diversity and inclusion from Cornell University, is a qualified administrator of intercultural development and inventory, has a certificate in the intercultural conflict inventory, and holds the certified diversity executive credential. Dr. Lawrence has recently been promoted to the rank of full professor of health policy and community health in the College of Public Health at Georgia Southern University. Her main research focus is community engagement in rural, hard to reach populations, especially those with sickle cell disease. Dr. Lawrence has been an investigator on numerous rural health and sickle cell disease related grants. She is currently a dual principal investigator on a $9.7 million patient-centered outcomes research institute grant entitled Comparative Effectiveness of Peer Monitoring versus Structured Education-Based Transition Programming for the Management of Care Transitions in Emerging Adults with Sickle Cell Disease. Dr. Lawrence is an award-winning coach for the National Center for Faculty Development and Diversity. She also serves as the Director of Research for the Sickle Cell Community Consortium and as the Editor-in-Chief of the Journal of the Georgia Public Health Association. Dr. Raymona Lawrence seamlessly bridges academia and entrepreneurship, combining her expertise in community engagement, psychological safety, and DEI with her passion for empowering professionals through effective systems. As the founder of the Systems Boutique, she supports authors, speakers, coaches, and consultants in streamlining their businesses with innovative systems that save time and reduce overwhelm. This dual focus allows her to advance academic research while offering practical solutions that help professionals bring their ideas to life and thrive in their work. Let's connect my conversation with Dr. Lawrence right now. I'm excited to introduce you all to our guest on this episode, Dr. Raymona Lawrence. How are you? Welcome to the podcast.
Thank you. I am doing amazing. Thank you so much for having me, Dr. Huntley. I'm excited to be here.
Oh, yeah. So, right away, I'm remembering I met you you were the keynote speaker at the Women's Leadership Institute back in Minneapolis last month or a month before.
Yeah.
And we had a superhero theme this year, and your presentation was just so wonderful. And you shared your superhero name, and now I need to write it down this time. I want you to, if you don't mind.
It is Dr. Ray Holla, Her Excellence. And so my name is Raymona Holloway Lawrence. And so it's just a short portion of my name. And then I just took the liberty to add Her Excellence on the end.
I love it. So I wrote it down this time because even when I reached out to you, I was like, oh, I'm trying to remember that. I just love that so much. I'm still working on mine.
Yes.
So everyone's listening. I'm like, what's the backstory? What's all this stuff? Worry about it. We'll fill you in. As you get to hear our conversation and get to know her, you'll understand a whole lot better the context. So I am really excited that you're here. I'm looking forward to our conversation. I really I knew when I met you that day and just spending some time with you, hearing your speech and seeing you engage and talking with you, I knew that I wanted to bring you onto the podcast as a guest. And I think your energy, everything that you are, that I got to get a glimpse of is what I thought I really want my audience to get a glimpse of that and to really make sure that you're introduced to maybe some people that are in my community that don't know who you are yet.
Thank you.
So as I often like to do when starting the podcast is I want you to introduce yourself and tell us about who you are, what you do, and then we'll start kind of diving into your journey.
Yeah. So I always start by telling people my lens and, because your lens is how you see the world and it helps people to see through your eyes a little bit and why you think the way that you do. And so I am an African-American female from the Deep South who was raised at the corner of black and blue. I always tell people that because being raised as a woman that's African-American in the Deep South has its challenges and it has a lot of fun as well. A lot of things about being raised in the South and not in the city was wonderful. But I also have a father who is a police officer and a Black man. And so that gave me a lot of insight into the world. One, it gave me an insight on my privilege because I was able to just walk into the police department and say, hey, buzz me back. And people would just let me in these locked spaces in this department. But when I looked out around in the environment, I realized that everybody didn't have that story. And so that is part of the way that I was shaped into thinking about how do we think about social justice? How do we think about ensuring that we use our own privilege to help other people. So having my experience as a Black woman in the South with a dad who was a police officer, and I was born with a chronic disease, a genetic disorder called sickle cell disease. And so I then had to navigate the healthcare system. And so all of those things together came, at this intersection of me getting a degree in public health and me really wanting to help other people who had sickle cell disease and wanting to make sure that I looked at disparities and inequities and all of the things. And so I really became interested in community engagement and how do we make sure that people have a voice and they have their superpower. They find that. And so that's what shaped me as I grew up from that foundation of being born in the South as a woman of color and then growing into what I became as I studied public health and wanted to go out and change the world. So yeah, that's a little bit of the origin story.
I love that. It's really important how you say, let me explain to you my lens,
Yeah.
because that's something we all need to remember. Our perspective, the lens that we view the world is unique. And I think that also strengthens us as public health practitioners. We have to realize
Absolutely.
that, our perspectives matter and are important and, are part of that superpower.
Yeah.
So I'm curious, this is a question that I love to ask also. And based on just your introduction, I'm just kind of curious, at what point did you first understand public health or start to think about public health as a career?
Not till after college, really. I did not know anything about public health. I actually wanted to be a physician because having to navigate the medical system, I thought this is the way that I'm going to impact sickle cell disease. And I always, from when I was a little girl, said I want to be a doctor that works with sickle cell disease, not knowing what it would end up looking like in the end. And so as I did that, I went into how do I do internships with medical doctors, with physician's assistants? And I did a 600-hour internship with a physician's assistant out at Augusta at the Medical College of Georgia. And as I did that, they said, I don't know if this is the thing that you really want to do. It's not a great lifestyle. They were just telling me all of the things, just really wanting to give me a full picture of what I wanted to go into, saying it's an amazing career, but the lifestyle is maybe not what you want. And so I started to think about the things that they said. And I looked down the list of physicians and I saw the degrees that they had. And I saw these letters, MPH. And I was like, what is MPH? And so I looked up the degree and I saw that these people looked at communities and not just individuals, and they impacted whole populations and all of these things. And I was like, oh, this is what I really think being a doctor should be. And so I looked into the MPH at Georgia Southern and went and got that degree, fell in love with public health, and then went and got the doctorate in public health as well. And so that's kind of how I came into it. I was just looking literally down the list of what physicians had as their degrees, and I saw MPH on a lot of them. And I went down the rabbit hole from there and have just fell in love with public health.
I love that. Very similar story myself. And a lot of, I find as I ask that question, a lot of my guests start the healthcare route because that's what we think of, the medical doctor, and then we discover public health. That was very similar to me. What I love from that is, in, more recent years, the popularity of the undergraduate public health degrees and that introduction to public health as a career option, being available to students much earlier in their journeys and starting to understand what public health is a whole lot sooner rather than kind of stumbling into it later, because it was much later for me by the time I stumbled into public health. But I do like that shift.
And it's so unfortunate because people don't go into their college years and say, oh, I want to major in public health. It's just not something that they have seen. And so I think we really need to get out into the forefront and let people know how great public health is, because public health seems to be like a feeder degree. I know that, okay, you came from biology or you came from nursing and now you found public health. And so maybe one day we'll be able to elevate it to a place where people just know about public health And I think in recent years, people have learned a lot more about public health with the pandemic and all of the things that have happened. But I think it still has a ways to go to be at the forefront of young people's minds.
Yes. That's something I'd like to see much more of as well.
Mhm.
Yeah. So now let's talk a little bit about, well, let's unpack a little bit more about what you do.
Okay.
So I know you wear many hats, but tell us a little bit more about what you're doing now. And I guess also I'm curious because of the different touch points you've had in your life as a young person coming up, maybe how does that kind of play a role in what you're doing now?
Yeah, I mean, I became that doctor for sickle cell disease that I always wanted to be. It doesn't look like what I thought it would. I'm a professor of health policy and community health at Georgia Southern University. And so I've risen to the top ranks of being a professor and done all the things to really become a researcher in sickle cell disease. And so I used to always say, I want to be an expert in community engagement in sickle cell disease. And I would say that as a very young professor. And my life just started to unfold that way. Right at the end of the time that I was an assistant professor, I got a $9.8 million grant for sickle cell disease where we looked at transitioning from pediatric to adult care in sickle cell disease. Because what people don't know is that, when you're growing up, you're making a transition to adulthood and you got to think about, where am I going to go to college? Where am I going to live now? How do I, again, navigate healthcare just in a normal sense? But when you put a chronic genetic disorder on top of that, now, when I think about where do I have to go to college, I need to think, is there a hematologist or a hospital that can treat me near that college? When I think about who I'm going to get married to, I have to think about, what is their genetic code? Because if I marry somebody else who has the sickle cell trait, then my children can have sickle cell disease, right? So it's a whole lot more added on top of that. And so that transition from pediatric to adult care is very difficult for individuals who have sickle cell disease. And so a lot of times people die. And so what we try to do is to bridge the gap between pediatric and adult care. And that's the work that I've done very heavily for the last 7 years with that grant. Is we were looking at, if we add a peer mentor to this individual who is transitioning to adult care with this chronic disease, does it make things better for them? And so just a lot of work with, how do we engage communities? How are we sure that we are doing true, authentic community engagement and not along the lower ends of the community engagement continuum where we just do outreach, but how do we move to this idea of shared leadership where we have individuals truly making decisions and being a part of this bi-directional conversation that we have with researchers. And so lately, I've been very interested in this idea of psychological safety in multi-stakeholder partnerships. And so, can we bring in community members with academic team members or with physicians and have them come in and be safe in that collaboration? Can they take risks without feeling like they'll be ridiculed or embarrassed or have any kind of other issue with this partnership? And so I'm very interested in, how do we make partnerships happen across these multi-stakeholder teams? And so that's the work that I'm doing now.
That's intriguing because we hear that's a topic of a lot of conversations. I'm going to use air quotes, almost conversations.
Mhm.
But at conferences like, these large public health conferences like APHA where we were, when you listen in on the panel discussions, and it's not new, it's the same theme that rises. Well, we need to have these difficult conversations. And I hear that. And it almost frustrates me. Well, no, it frustrates me
Mhm.
because there's this point where we realize, yes, that's what we need to do. And then there's the point of actually doing that. So speaking for myself, Black woman, also I spent my first 10 years, well, I was born in New York, but within the first year I moved to Mississippi. So in those first 10 years of life, I was in the deep South.
Mhm.
And it's a whole different mix of culture
Yeah.
and very unique. And so, fast forward, now I have a blended family. And So my whole life, I'm saying this to say, my whole life has been having difficult conversations. That's just what I've always had to do. It's not like I get to choose to have it or not have it. So when I think about public health now and our leaders that are saying we need to have these difficult conversations, almost as if we have the option to wait until it's whatever we get it right to do it. Like it's not optional.
No.
So when you talk about the work that you're doing and, I wrote down psychological safety. I like that phrase.
Mm-hmm.
Like, how do we, and this is a heavy question, but really timely, I think, how can we, those of us that feel like, well, I do this every day all the time,
Mm-hmm.
and then maybe we are in some of these organizations where they're talking about making the move, but they're not moving. How can we pour a little fuel on that or maybe take a little bit of a lead to do some of those things? Because I love how you're initiating and you're actually, this is what you're doing. Like, how do
Mm-hmm.
we get some of the, some traction in some of these other areas where they're still talking about having the conversations instead of diving in to have the conversations?
Yeah. And I think a lot of times when we talk about these conversations that you're talking about, what happens is we skip over the real work. So we have these conversations, but the real work starts with us. So you can't take your inclusion hat off at home and then come to work and say, oh, I'm inclusive and I do all these things and I really care about communities and all of that. The work has to start in the individuals because the individuals make up the organizations. And so I think that's a huge issue because people say, that's the touchy-feely stuff. I don't want to hear about that. Dr. Raymona, give me a checklist of things that I can do to be inclusive. I'll check that list and then we'll go to the next thing. And it's like, whoa, no, it's not happening. And that's why we're not making change. The next thing that we're doing is that we're not listening. So I was just doing a project. We did all of these focus groups. I looked at the survey that they put together from the focus groups, and it didn't say anything that the focus group said. And it's because the academics said, here are the things that we're thinking about and we think they need to know. So we'll put this on the survey versus what the people actually said. And so we have this kind of thing as academics sometimes where we're like, we know the literature, we know the things that we've been trained on, and we have that tunnel vision and we say, these are the things we're going to put down. But if we took what the community actually said and say, let's talk now about how we can translate this into real action, then we could make something happen. But what we're doing is we're doing these performative things where we bring the community in and we say, hey, tell us what you think. And then we say, but we're going to think what we think. And then we're going to put together these programs. And so I think that's where the disconnect is. And so what can we do? We can bring it up and say, hey, I don't see what the community said reflected here. We have got to take this, what they've said, and think about how does it work? Yes, we have wisdom as academics on some things that work, but after that, how do we make sure that we use the wisdom of the community as the foundation for what we're doing? And so we have to constantly bring it up. We have to have people who have the community's best interest at heart and that they are willing to, again, have those hard conversations. The hard conversations are with ourselves and it's with our colleagues when we say, no, I don't see the words that the community used here. How do we translate this in a way that it works? And it's hard because funders ask for different things. There's a lot of dynamics, and I get that. But we also have to say, how do we challenge? And my thing in my life and in my businesses, I say, I challenge broken systems that keep people from reaching their highest potential. And so it's like, we've got to challenge these systems where we just get funding because the funder says we want to do this. And then we try to maneuver our way into answering this funding, right? We've got to think about the communities and really, truly be advocates. And that means having community members' voice there at the table and listening to that voice when they speak.
Yeah. Thank you for that. I think that puts it in a way that I think no matter where you are listening, like if you're even as a student, there's some action that we can take, that active listening and then kind of speak up. it's like different level of or different way of thinking about advocating for the community in those meetings saying, hey, the community said this, but I don't see it reflected in what
Mm-hmm.
we're putting out there.
Mm-hmm.
Make them accountable. Sometimes I think researchers and leaders that are putting these questionnaires together can inadvertently leave that out. But
Mm-hmm.
if someone's tapping them on the shoulder, I'm not going to assume that, like, well, we're going to have our own agenda, but maybe sometimes they're used to doing it that way. But if somebody in the room is going to tap them on the shoulder and say, well, wait a minute, I was there when the community said this, but it's not reflected here,
Mm-hmm.
then, that's something that we can respectfully bring up. And you don't have to be the leader of the meeting to be able to interject your thoughts. There's always that point of that on the agenda. Any other business, any other questions,
Yeah.
raise your hand
Yeah.
and bring that up.
Yeah, and that's me. My hand is constantly up, and people are like, they bring me in to do engagement work, and they're like, oh my gosh, we did not know what was happening. But it's a good thing because I'm constantly the person that's saying those things. And I tell people, choose your area of disruption, right? So what happens is people think that when we say go out and advocate, that we mean you got to carry signs on the street and do all of these things. No, that's not everybody's thing, and that's okay. My area of disruption is in any room that I'm in, I am going to raise my hand and say, did the community say that? And now are we translating that into action? I disrupt that way every single time. So choose your area of disruption. It doesn't have to be the traditional things that we see with like civil rights activists and things like that. It can be, what is it that you are here in the room to do, and choose it and stick with it. Do it.
I wrote that down too. I love that for myself. If nobody else wanted to note that one, that I love that. I absolutely love that. That helps us to not be overwhelmed and consumed by the big giant problems. Like you can just bite off a piece and like own that.
Mm-hmm.
And I like that very much. Well, thank you for going down a little bit of a rabbit trail with me, but very, very timely and very relevant for where we are. So tell me more about what you do, because I know you also have this entrepreneurial vein that you explore. So tell me a bit more about that.
Yeah, I'll tell you. One day I was in a meeting at my university, and the faculty were talking about a grant, and they were talking about their summer salaries. And they were just kind of going back and forth and arguing over a percent, right? Because, we have a 9 or 10-month contract, and faculty don't get paid in the summer unless they have grants. And so it felt in that moment that we were so concerned about the money that public health was not at the forefront of our conversation anymore. It was, how much are the faculty going to get paid from this grant and to pay their summer salary? And at that moment, which was very early in my career, I think it was in year 1 or 2, I said, I will never have the university pay my summer salary again. And that's what started me into this entrepreneurial journey. And we often are like, okay, we don't make enough, or how do we do this, or how do we do that? And it's like, no, start your journey with entrepreneurship and be the engine that you want to be, right? And so that's what I did. And I initially started with network marketing. Felt like the easiest business to go into at the moment. And as I was in network marketing, I really got trained about business. I loved the industry, got trained a lot about business in network marketing. And eventually they found that I had this degree in public health and that I did this work with diversity, equity, and inclusion. And they started to fly me all over the country to do training, DEI types of training with the consultants. And so I did that, loved it, but I was censored. And so I would have to present the script to the company, make sure I said the things that they wanted me to say. And so I got frustrated with that. And I said, I have the skill set here. I can go out and do this business myself, and I don't have to do this in this network marketing company. And so I did. And I started speaking, coaching, consulting as it related to DEI, networking, those types of things within companies and teams. and really started on my speaking journey, consulted multiple pharmaceutical companies and different organizations, the Georgia Council of Court Administrators. I mean, I've done a lot of different things with people looking at this idea of multicultural teams, multi-stakeholder teams. How do we bring people together to ensure that they are able to do the work of mainly public health or sickle cell disease? And so eventually, though, I said, well, I am teaching, I'm opening all these doors. But when I open the door, a lot of times the business owners don't have the skill set to walk in the door that I opened. So I said, they need these skill sets, they need the systems. And so I started an agency called the Systems Boutique. And within the Systems Boutique, I set up the back end system for women and minority business owners. So all the tech and the team that a person could ask for is all in one system. And so I run that agency as well as the speaking, coaching, and consulting that I do with companies. And so, yeah, that's a little bit about my entrepreneurial journey.
I love your story because I think, I mean, that's going to resonate with a lot of people as well. But I like that you're such a great blend. Like you've had this traditional career that you love and that you're excelling and thriving, and that is very foundational. But you also have this creative entrepreneurial vein and this way that you're pulling and supplementing and filling in. Like you said, you decided, I love that you decided I'm not going to, the university is not going to dictate, or I'm not going to be preoccupied with my summer salary from the university anymore.
Mm-hmm.
And then you write your own way and your own path, and they're very complementary. And I think it's like you get the best of both worlds, but you're also inspiring and teaching. And I'm sure people are just, being inspired by watching you and what you're doing and how they can also lead and do in a similar way with something that is a topic or an area or, that's near and dear to their heart as well.
Mm-hmm.
Have you found that to be the case? I'm pretty sure.
Yes. People ask me all the time, especially other academics, how do you get out there? How do you figure out, how to merge academia and being an entrepreneur? And I mean, I love it. I love systems. I love to think about how to connect the dots for people. And I do that as an academic, right? So I have to teach students, especially undergraduate students, how do you know how you go from your lit review to actually putting on a public health program? There's a lot of steps in between there. So how do you connect the dots between all of that? Because they're like, how do my objectives even relate to this needs assessment? And how do my activities relate to, and so it's confusing. And that's how it is with entrepreneurship too. People are like, I don't know how all these different things fit together. I have all these apps, the programs, what in the world? And so I just do the same thing, but just in a different way. And academics are authors, right? So are entrepreneurs. Academics have courses that they could teach other people and sell. So do entrepreneurs. So there are so many similarities. And I just set the systems up in between so that everybody is able to have that functioning back end that they need to really have a professional business.
I love that. Well, I know we're going to have links to connect with you on our show notes page because people are already thinking, I got to talk to her. So we'll make sure that we have that. So one more question as we wrap up. For anyone listening that might be interested in something similar to what you're doing, is there one bit of advice that you could just share with them? Is there listening like one thing that you would just kind of drop, a little gold nugget to drop for somebody that's thinking about, maybe they're an academic and they're thinking, how do I do this? Or they're just thinking, how do I get into some area that you've touched? What would you suggest?
I would say discover your own brilliance and what that is. I read a book by Dr. Patrice Buckner Jackson, and it was Disrupting Burnout. And she talked about how you disrupt burnout, which is what we often have in academia and education, and how you actually discover your brilliance. And in this book, she talked about, here are the things that you do to discover this brilliance. Think back, not what you've been trained to do, but what do people ask you about, even since you were little? And I thought about that and I was like, people have always asked me to be on their team. help them solve puzzles. I was able to connect dots for people. I always have thought in systems, and a lot of people will say, here's one incident that happened, but I see like all the things that have happened around it. And so that's my brilliance, thinking in systems, thinking about big picture, connecting the dots for people. And then I use that to say, okay, now how do I monetize this? So now what are the things that I can do? Not just one thing. Think about a few things that you can do once you figure out the brilliance to monetize it, and then try them. That's the thing. Often we think we might like something, or being an entrepreneur sounds good, but it's not always good when you're in practice. And so, what are the things that you enjoy? What would you really want to do for the rest of your life? What actually fits if you want to continue to be an academic? Because you have to think about, I still have to write papers and grants and teach and do all of those things to get evaluated as a successful professor. But then I have to juggle having this business and all of those things. And so what is it that you really want to do? Not what looks great for other people. What fits your lifestyle, and what do you want to do? And so I think discovering your brilliance, thinking about what you really are great at, not what you've been trained to do, but what you're great at just naturally. And then thinking about different ways to monetize that, and then practice those things. Try it. See what you like, see what you don't. And the last thing is mentorship. Let's go full circle to what we started this with, and how we met is I was talking about 360 mentoring and how you find your superpower, right, by mentoring. And so I think that's the next thing is, how do we find people who have done this, who have been successful, who help you skip the parts that they failed at, and teach you how to move forward and really be an academic and an entrepreneur. And so those are the things that I would say, that's the start, and that's how I would start anybody.
I think that's wonderful. Thank you. I've enjoyed our conversation. I mean, I love podcasting. I love having my guests. This one, I felt I was being a little selfish on. So a lot of those points and things that you talked about was for me, but I know my audience is appreciative and taking this in as well. What is the best place for people to find you or want to connect with you? If someone's listening right now and they don't want to go clicking to the show notes, but what is the best place?
Yeah, you can find me in multiple places, DrRamonaLawrence.com, and my name has a Y in it if you're listening. So I always say, don't forget my Y and don't forget your Y for the things that you do. So I have a Y in my name, and so it's DrRamonaLawrence.com. I also have thesystemsboutique.com if you want to know more about that piece. And I'm on social media. So Instagram, LinkedIn, all of it is either Raymona Holloway Lawrence or Dr. Raymona H. Lawrence. So you can find me in most places, and I hang out there, and I'm happy to interact with anyone.
Oh, that's wonderful. Yes. And we do have all of that in the show notes. So Dr. Ray Holler, her excellence. Thank you so much for taking time and meeting with me today and putting this episode together. I really enjoyed it, and I appreciate you so much.
You are very welcome. Thank you for having me.
I really hope you enjoyed that conversation as much as we did. Dr. Lawrence is a true leader and innovator, and is having a big positive impact on the communities that she serves. I encourage you to connect with her and learn more about the work that she's doing. You can find the links to connect with her on the show notes page for this episode. The show notes page for this episode, which is episode 396, can be found at phecpodcast.com. Once you're there, just navigate to the episode number 396 to find its show notes. One more thing before you go. Please take a moment and share this episode with a friend. I'm sure you know someone or several people who would be interested in hearing this conversation. If you're listening right now in one of the podcast apps, you can easily share this episode through a text or directly to social media. At the bottom of the show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.